Pertussis disease is very prevalent. It is a disease that will be affecting the populations of all ages. We can get pertussis at any time in life. Usually it is a milder illness in older children and adults, but the very young are the ones who will have most severe complications. We do have effective vaccines, and we are able to reduce the risk of more serious disease at all ages with primary vaccination and subsequent boosters. But we are still having a need to prevent the most severe disease in the very young infants. And the only way to be able to do this is really through maternal vaccination. This is a very well-known and proven strategy that increases the protection of the infants by increasing the antibodies in the mother, and that it has been shown to be safe and effective and very much a critical intervention that has reduced the mortality and severe disease in many countries throughout the world. And maternal vaccination is one way to be able to protect these babies against pertussis and its complications.
This is a huge public health measure. It provides a protection for the most vulnerable population, so this is really important. Latin American region has already introduced the vaccine more than 10 years before, and we have a huge experience regarding effectiveness and also regarding safety. That's why we are sure that it's really important for the region to introduce the maternal immunization with Tdap to protect newborns.
We spent 3 days in a workshop addressing the issue of pertussis among young newborns, and also preventing the newborn infection through maternal vaccination. Experts from the region and internationally in countries where they had done significant work on pertussis vaccination were involved.
The region is also witnessing huge problems actually with the pertussis. I mean, with the outbreaks now more and more occurring in the countries, even in those that are performing very well in terms of routine. So in this workshop we are trying now to support countries to understand better the epidemiology of the disease, focus on the under 2, focus on introducing the acellular pertussis now for pregnant women, working with the country available stakeholders, including the maternal care. But beyond that also, this is a good opportunity for the country to go back and look at the data for pertussis, understand why they are having this resurgence now, despite the fact that the coverage seems to be high.
I think the conclusions were quite positive that the region is ready for moving towards maternal immunization, addressing this as a critical issue in trying to ensure vaccination of pregnant ladies during their pregnancy, every pregnancy, to prevent mortality among the newborn.